So this is a nice case, well, kind of nice. Not nice for the patient, but nicer for practicing. So this one, so this is hematology. So it presents, so your foundation U2 doctor, again, it's this one's in the GP surgery. The patient's name is Marcus Rashford. He's a 25-year-old man. He's presented with tiredness. You don't have any other information, and you've been asked to take a focused history, perform relevant examination, and discuss initial management with the patient. So with this one, yeah, just a quick kind of history, tiredness. Maybe do an examination and discuss kind of your initial findings. I'll give you the findings of the examination. So you're expected to, make an assessment based on the history and examination. And based on that, you make an assessment, you give a provisional diagnosis, and you suggest we tell them what your initial management is going to be. Are you worried? Are you not worried? Are you going to reassure them, or are you going to tell them that, we need to refer you to the hospital, for example? Right. So who would like to tackle this one? The tiredness scenarios are often not very popular, which I completely understand, because it could be a number of different things. But always remember that the point of the task is not necessarily to get to a diagnosis, because you don't have all the necessary information to get to a diagnosis. The point of the task is to be systematic, to ask relevant questions, and to take appropriate action. To reassure or to step things up, to recognize that you don't necessarily need to know what the problem is, especially at at this early stage. So that's what investigations are for. These histories and examinations are just to give a clue. So I wouldn't worry about, I don't know what this could be. And even after taking the history and examination, you don't know what it is. You'll just talk. You can't go wrong if you just talk to the patient about your thought process. Tell them what you're thinking. I'm thinking. A possibility is this. But I think more likely is that it's this. But I'm less inclined to think that it's this because of this. And you just kind of explore the different options and your thought processes, and just be transparent with the patient. You are not expected to get to the diagnosis, so I wouldn't worry about that too much. Any questions before we start this one?
No. It's just that I'll just try my best. It's okay.
Yeah, just just a basic history. You're not expected to you don't need to have read up on the condition. Just take a very basic history. Just use your intuition, common sense, and just ask kind of basic questions, history, and then do an appropriate examination, and then discuss your findings. That's about it. Yeah. Okay, when you're ready.
So hello.
Hi there.
My name is Junior Doctor here. What's your name and age, please?
Hi there. My name's Marcus Rashford. I'm 25 years old.
Okay. So what brings you in today? How can I help you today?
Yeah, I've been really tired, doctor. Like really bad fatigue.
Okay. Can you explain more about the tiredness?
Yeah, I think it kind of started when I noticed it first after a football competition, playing football, and yeah, it's just ever since then. That happened about a week ago.
A week ago.
Yeah, since then it's just got worse.
Sorry to hear that. Do you have any other associated symptoms apart from being tired? Any other symptoms?
Yeah, actually, I noticed a couple of bruises on my arms.
Okay.
Yeah, just the last couple of in the last few days.
Okay. Any headache, vomiting?
No headache or no vomiting. No.
Okay. And has anything changed recently in your life or anything? Are you sleeping enough?
Yeah, my sleep's okay, but it's just something not right, because I also So apart from just the bruising, I also
Yeah.
noticed when I brush my teeth, that my gums are bleeding, and I've never had that problem before.
Okay, all right. So this all happened a week ago. It's never happened before at all.
Never, no.
Okay. So do you have any shortness of breath, or can you, like, your heart beating faster than normal?
No, I've not noticed anything like that. No.
Okay. Apart, have you had any other bleeding before, apart from the bruising and gum bleeding?
Any other bleeding?
Yeah.
No.
Okay.
No.
So any other history of illness, any other illnesses you've had before?
So no, I've never had any problems, to be honest, doctor. Just I mean, recently I had the flu, and
Okay.
yeah, no coughing or anything like that, just kind of like a runny nose and stuff. I didn't say it earlier because I didn't think it's that important. Yeah.
Okay. So are you currently on any medication, or that's
No, I'm not on any medications, no.
okay? So any blood that in your urine or in your poo, any blood at all?
No.
No. Okay. So okay. So I'm going to do some. Sorry, there's something I left out. Do you smoke or take any alcohol?
No, I don't know.
Okay.
I do drink, but I don't smoke. I just drink occasionally, maybe once a week, but nothing. I'm not a heavy drinker, no.
All right. All right. So anything else that maybe you can tell me about the symptoms? Anything else?
Yeah, I think that's about it. I mean, I've just been really tired for a week now, and it's getting worse. And yeah, I suppose the other thing is I've been lost maybe about 4 kilos.
In a span of how long?
Around 1 or 2 weeks. Yeah,
Oh, okay.
about the
All
same
right.
period. This all happened quite recently. Yeah.
Okay. Any night sweats or any fevers at all?
No.
Okay. All right. So I'm going to do a general exam and just take your vitals, and then I would want to just do a general examination with
Right.
a thyroid examination as well. And I'll send you for some blood tests. We need to do a full blood count check just to see the levels of the tests. The
Right.
levels of, I'm worried about platelets, so I need to check that, and your full blood count, everything of your hemoglobin. Yeah. So those are the tests I'm going to do, and
Yeah.
a blood film as well. And yeah.
Okay. So investigations, you're going to request those, but for the
Yeah.
observations and examination, so observations are relatively normal. They're fine. On examination of the abdomen, you noted the liver and spleen are enlarged.
Okay.
And on examination of the mouth, you saw a picture of a bleeding gums.
Okay. All right. So all right. So after I've done that, so what I'm thinking is I'm working with a diagnosis of is it ITP? Sorry, idiopathic thrombophlebitis.
Right. What's that, doctor?
So I think because of the illness you had, your immune system is your platelets are low. Those are the ones that clot blood. That's why you're having the bleeding, and yeah. So, but we're going to do the tests and start you on management, and I'll also discuss with seniors on the way forward. Yeah, but we're going to take care of you.
Right. Okay. Okay. So what does is that why I've been bleeding, doctor?
Yes, that's the reason why you've been having the bleeding, because of that platelet disorder, and it's just that your platelets are low. Yeah.
So what about like the weight I've lost? Like my parents, when they saw me, they were really concerned about the weight.
Yeah.
Does that explain my weight loss?
So I'm going to do other tests just to to rule out other differentials, other diagnoses that might be causing the weight loss. Yeah.
And the tiredness as well, is that related to the bleeding?
The timing?
The tiredness.
Yeah, the
really
tiredness.
tired.
Yeah, because now you've been having the bleeding. So the blood counts. So I should get the blood counts and just see how the level is. So that's also related to your tiredness. The bleeding is related to your tiredness as well.
Right. Okay.
Yeah.
Okay. Thank you, doctor.
Right. Okay. So I'm going to send you to hospital just to do the further tests, and I want you to be seen by a hematologist as well.
Right, okay. When am I going to do that? Do I have to do that now, or is that an appointment?
Yeah, I'll send you right now.
Okay.
Yeah.
Okay. Thank you, doctor.
All right.
Yeah. So how's that?
Oof. That one, I don't know.
It's good to practice thinking on your feet there.
Yeah. I really have to do like more practice, I feel like, because I think I wasn't ready for this tiredness scenario. So I think my mind went blank. Actually, I had a mind block. So, and that can happen in the exam. So I really need to do a lot of practice. Yeah.
Well, I think honestly that's, you've done so well. You've practiced two stations today, and I think you're going to gain a lot of value from that, because I think particularly the second one, because at the end of the day, when you're working as a junior doctor, an FY2 doctor, you don't know what the cases are in front of you. They don't have a diagnosis or even a presentation on their forehead. They don't have like a tag on their forehead that says head chest pain. Oh yeah, I'll do this one. I'll do this one because it says chest pain. Yeah, I'm okay with that one, but I won't do this one. At the end of the day, you have to be prepared for whatever is in front of you, and you don't know what it's going to be. And so the more you replicate, what's going to be in the exam and what's going to be in practice, the more it will help you. So I think you need to keep practicing until you feel confident to approach any case without knowing what it is. Once you've got to that stage, that's when you're ready for the exam.
Yeah.
Does that make sense? Yeah.
Yeah, makes sense.
So that's really good that you volunteer. I think you'll really benefit from, especially that second this one we've just done. So yeah, it was a tricky patient. Hematology is always difficult because it could be, or you don't know that it's hematology necessarily, although I did say, but it could be any condition really can present with tiredness, so it's very, very general. And so yeah, so it does require an open mind. However, the key theme in this case is recognizing red flags.
Yeah.
So yeah, so he's presented with a tiredness for a week and fatigue in combination with bruising and bleeding gums, and also weight loss. So weight loss of 4 kilograms, that's quite significant for quite a short period of time. It's quite rapid weight loss. So those factors, he did mention having a runny nose. I don't know whether to put too much thought into that, but yeah, the point is that those in combination in a 25-year-old man, in combination with the examination findings, which showed a liver and spleen enlargement, most notably, they were the most notable findings. In combination, that should raise alarms, and so the doctor should be concerned about, should think about cancer. And so this patient needs to be, referred immediately to investigate for possible cancer, leukemia.
Yeah.
Definitely ITP, I'd say, is one of the differentials, but because of the what I've just explained about the combination of symptoms, you have to. It's very important that you do not miss a diagnosis of leukemia in this young man. Does that make sense?
Yeah, it does. It does, for sure.
So the weight loss, because you gave me a provisional diagnosis of ITP. However, that does not explain, the fatigue. Okay, he's got bleeding gums, but how much is that going to affect your hemoglobin level to the extent that you're fatigued for a week? I don't think it would. So that doesn't explain the fatigue, and it doesn't explain the weight loss. So when he starts talking about systemic symptoms unrelated to, bleeding, then you need to be considering other differentials like leukemias and lymphomas. So definitely, lymphoma is also another thing to think about as well. So, thinking about, have you got any swellings in the neck, armpit, or groin? But yeah, leukemia definitely is. So really, with these hematology cases, when someone's presenting with tiredness. So you want to think about your red cells, your white cells, and your platelets. So your red cells, so okay, he could have anemia, or he could have thrombocytosis. Okay, so let's ask about anemia symptoms, which you did. You asked about, so obviously he presented with fatigue and tiredness, but you also asked about palpitations and breathlessness. So that's tick, done. Next one, we've got bleeding. Okay, you asked. Okay, so you asked about other things, and then he volunteered the information about the bleeding and the bruising. Okay, good. So we've got that ticked off. So he's bleeding. So he might have a low platelet count, or and then the last one. So low platelet count, yeah, that he could have idiopathic thrombocytopenic purpura, but in combination with the other things, and also he mentioned having a runny nose, but yeah, so he could have impaired immunity as well from involvement of the white blood cells as well. So yeah, so he could have. Seems like he's affected in all three, and that in combination with the weight loss, okay, that raises alarm bells. So in this age group, you're thinking about acute myeloid leukemia,
yeah,
potentially, but obviously you wouldn't never be able to diagnose at all. But the important thing is not the diagnosis. The important thing is recognizing that this should be treated urgently, and this could potentially be cancer, and so you don't want to miss that.
Yep.
So have a low index of suspicion for cancer. Always have a low index of suspicion, especially when someone has weight loss, unexplained weight loss. So yeah, so rashes, bleeding disorders. Yeah, I mean, you explored nicely all the the bleeding related symptoms and conditions. It was just the the weight loss. So this is a good learning experience in terms of not forgetting the risk factors of cancer, the red flags for cancer.
Yeah, because I think once you don't have, when it's not in your head, you'll miss it for sure, because it wasn't in my head. So I think that's why I missed it.
This is why I always think that it's nice to always include weight loss and fever as questions in your history. Just as a general rule, it will cover you for missing certain things. So I always think weight loss and fever are two really important questions that should be pretty much set in stone in your history of presenting complaint. And then one other thing is just the lumps and bumps. So you can ask them if you notice any lumps and bumps around the body. That's always a nice red flag question as well. If you want to think about could you have cancer or metastasis or something like that. So yeah, that's a good one to ask as well. Yeah, so yeah, so the cancer. So just explain to him. I would ask maybe in the family history any history of cancer. Obviously, that might alarm the patient, but you just explain to them that you need to be thorough at this early stage and you don't want to miss anything important. So yeah, observations. So observations. Where have we got to? Just here. Yeah. So head to toe examination. Yeah, just one thing with the examination. I would say mention the glands, the lymph nodes. Mention that you want to do lymph node examination. So you mentioned general head to toe, which is fine. But just to just to speak to the examiner, or just so the examiner knows what you're thinking about. So including an abdominal exam, including an exam of the lymph nodes, and the mouth, and the bruises. Specify exactly what it is you're looking for in the examination. But yeah, the big one was when I told you the liver and spleen is enlarged. That was in combination with weight loss and with these hematological symptoms and anemia and all that stuff. That's raising suspicion. So you need to explain to the patient at that point is, from my initial assessment, I am a bit concerned about what you've told me so far. So it's particularly important that we don't miss any important conditions like leukemia. So I am going to put in an urgent assessment for you to be seen by a medical team, to be seen by a blood specialist, a hematologist, and a medical team. So that's important to get that in there. And then, then you can talk about the investigations they would do in the hospital. The specialist will do the investigation. So I think it's a bit, it is confusing about, am I doing the investigations or are they doing the investigations and the specialist? And it is confusing, but again, this is a GP surgery. So it's likely that you will do your basic bloods. Any kind of all the basic investigations are done in GP surgeries, but the other things like blood films will be left to the specialist. So the specialist might do a blood film and all those kind of things. Yeah, and they might do a chest X-ray, look for hilar lymphadenopathy and things like that. Yeah, inform the senior is an important thing to point out here, because you need to show the examiner that you are concerned. So you're going to inform the senior. The question is, the notes here say immediate. So usually the suspected cancer pathway is 2 weeks, right? But for this one, it might be worth doing an immediate referral to this patient, I think, because this patient can't afford to wait for 2 weeks. I don't think. They need to be seen straight away and assessed straight away. So, just because they don't have cancer doesn't necessarily mean that they're going to be put on a 2-week wait pathway. It may be that you want to fast track that even sooner to an immediate referral. Yeah, and just try to not give if you're not sure, don't give a diagnosis. So it would have been absolutely fine if you just said, if you didn't mention leukemia at all, and you didn't mention any diagnosis at all, and you just said, to be honest, from my initial assessment, it's early, but from what you told me, I'm I am worried about some of the symptoms that you've got. So I'm going to put in an immediate referral and to the hospital for you to see a blood specialist, because it's really important that we don't miss any but to include leukemia or not. I would say I would include it if the patient was not really taking it seriously, then you need to tell them this could potentially be leukemia. But otherwise, I would be hesitant to mention leukemia. To be honest, at such an early stage, I'd be really hesitant. I would just alert them that you are concerned, and that should cover you.
Yeah.
And while at the same time keeping your options open. Yeah. Hopefully you found that useful.
For sure, it's like this. I think this one is really I've really learned a lot from this one. Yeah, and just how to, because sometimes when you're not really, because the only thing that was in my head once I started taking the history, I was a bit worried. Then my head went blank. So I think sometimes that can happen when you're not. You might not be confident in a station, but you just have to keep on going and just exploring. And I think practice will help with that as well. Yeah.
Yeah, you've got to when I forget to ask weight loss in a scenario that could have been where it was relevant to tick off, and when you make that mistake and then you look at the answers and you say, oh god, I've got to ask weight loss, and then it re-etches that neural pathway in your brain that when I'm taking a history, it's important to ask about weight loss. Make sure that's a high leverage question. Make sure I include that because that can cover me for red flags. Because at the end of the day, the exam is not forgiving when it comes to missing red flags and safety netting. So, being safe is the purpose of the exam, is to make sure that doctors are safe. They're not expecting you, the doctors, to be highly skilled in anything at this stage. It's just about being safe and being able to communicate well. They're the main things,
Yeah.
Great.
For sure.
Any other comments, from anyone at all?
Thank you so much.
No problem. Thanks for coming.